Hi and welcome back to another video of Medic Notes. This video is on ACL injury. ACL, anterior cruciate ligament tears are common athletic injuries leading to anterior and lateral rotatory instability of the knee. Diagnosis can be suspected clinically with presence of a traumatic knee effusion with increased laxity on Lachman's test, but requires MRI studies to confirm diagnosis. Treatment involves ligamentous reconstruction utilizing a variety of techniques and graft choices depending patient age and activity levels. It is a common injury, accounts for half of all knee injuries. More commonly seen in female athletes. Risk factors are valgus moment at knee and adduction moment at hip upon landing, and previous concussion. Patients present with pain deep in the knee, and immediate swelling or hemarthrosis post-trauma. They might also hear a pop sound. Symptoms of ACL tear are generalized knee pain, feelings of instability preventing return to sport, and difficulty weight-bearing. On inspection, look for effusion, quadricep avoidance gait where the patient does not actively extend knee, coronal or sagittal plane deformity. Varus deformity increases risk for ACL re-rupture. For motion, there will be lack of full extension secondary to meniscal injury or arthrofibrosis. Also evaluate for meniscal or concomitant ligamentous injuries by using other special tests. For neurovascular, evaluate perineal function following high-energy mechanisms and suspicion for multiligamentous injury pattern. There are some special tests for ACL injuries. Lachman test is the most sensitive. Another test is the pivot shift, where the knee is brought from extension to flexion, with valgus and internal rotation of tibia. Reduces at 20 to 30 degrees of flexion due to IT band tension. For imaging, do a knee X-ray AP and lateral, to look for any fracture. Knee X-rays are usually normal. Possible findings are second fracture, which is a avulsion fracture of the proximal lateral tibia, or deep sulcus sign, which is a depression on the lateral femoral condyle at the terminal sulcus, a junction between the weight-bearing tibial articular surface and the patellar articular surface of the femoral condyle. Other imaging is MRI scan of the knee, to confirm the diagnosis of an ACL tear. Possible findings are discontinuity of fibers on T2, abnormal orientation, bone bruising, shown in the first picture, tibial spine avulsion fracture, and empty notch sign, shown in second picture. We can also do a CT scan of knee to evaluate for bone loss. Treatment can be conservative or operative. Conservative treatment is physical therapy, lifestyle modification, and rehab. Operative treatment include ACL reconstruction, ACL repair, or ACL revision reconstruction. There are many possible complications of ACL tear, listed here. For prognosis, ACL deficient knees believed to lead to an accelerated progression of arthritis. Near complete restoration of native kinematics following reconstruction. And there is a high level of return to sport at all levels of competition. That's all for this video. Thank you.